excited to be here with you. Welcome to Candice van Wyk. We're very happy to have her with us today, both as an AXPAR warrior as well as a medical professional. She is a nurse who is specialized in operating rooms, and she's been in the profession for more than 20 years. And I'm really happy that she can be with us to share her experience, not only as a patient, but as a support and a medical professional. And yeah, we're happy. Thank you, Candice, for joining us today. I also just want to say that this is a space for those of you who have just joined us in our group. We're really happy that you're here. And for those of us who have been with us for a while in our group, again, such a warm welcome to everyone here with us watching. Maybe some of you are watching the recording, maybe you're with us live. For those of you who don't know what our AXPAR group is and who I am, I'm the vice chairperson of the Axial Spondyloarthritis Association of South Africa. I'm a physiotherapist and a health coach. And in this group, we want to ensure that every person receives a timely diagnosis with AXPAR and really gets the appropriate care that they deserve. We want people to feel empowered to take decisions about their own health and feels we're part of a supportive AXPAR community. One of the wonderful things about our group, as I'm sure you've noticed or witnessed or will start to notice, is that our group, it really takes an empowered and optimistic focus to the condition as AXPAR, and you all are joined in this experience of either being an AXPAR patient or support for an AXPAR person in your family, or maybe you're a medical professional, and we all have different experiences and understandings of the disease, and this is a space where we can share challenges, share wins, and share journeys. And with that said, Candice is here to share her journey with us. And we're going to talk a little bit about where it all started, how it all evolved, and then what she's found to be the most supportive and helpful, both internally and externally, and any tips that she has for us. So Candice, welcome to the space. We're really happy to have you here.
Thank you so much. It's an absolute pleasure.
Yeah, so tell us a bit about your journey.
So I am a nurse now for 21 years, but in the beginning of my training, I started having some backache, and I thought, oh, well, it's the long-standing hours, and I just took it as that what it was. And then I experienced my first pregnancy, and it just got worse after my son was born. And then my third son, I was pregnant with him, and all the doctors said, oh, well, it's induced by pregnancy, hence the stiffness, it might be carpal tunnel. And then all of a sudden it got worse, and I started with enthesitis, plantar fasciitis. I would go to work and drive myself, and it got to the evening, I couldn't move my leg at all. I just had enthesitis on the knee and couldn't move that limb. And usually for me, it lasts for about 3 days, and then it goes away like it never appeared in the first place. Mm-hmm. And so I sought out some help in Durban, and I went to a rheumatologist. Going to all the orthopedic doctors, they kind of do rheumatoid factor, and they say, oh, well, your rheumatoid factor is negative and your bloods, they seem okay. I think it's just a little bit of inflammation, but yes, there's some anti-inflammatories, and off you go. I did that a couple of times and tried different doctors. In the end, it didn't help at all. And after I saw the rheumatologist and we started off some basic treatment, and that was in 2008, after my last pregnancy. And working in theatre, you kind of are required to be present, full body, mind, and spirit. You don't have a choice. And after I started the treatment, I noticed a little bit of improvement. And there were days where it would be really bad, and then there were days where it would be great. but I did notice that there was definitely an improvement. Moved up to Johannesburg in 2009, and the working conditions and the stress was just so much more that there were just so much more flares. And sought out a rheumatologist here, and we did ultrasound of the tendons and noticed that there was inflammation around there, heat sensitive, and we started a different plan of treatment. And I think my whole journey has been about finding what works best for me, what works best for my body. Because we're all different. We get the flu different, you know, we just respond so differently to different things. And so it's been a long journey of finding what works for Candice, because it's my disease. I have full ownership of it. And everybody that I get to assist me are all helping make me better. And if it doesn't work well for me, then I've got to think of what else should I do? Is it my stress, number one? Is it my diet? Is it my immobility, not moving, not keeping myself active? So many aspects that affect me personally. So through the years, I had to work out, going on a holiday, how stressful is that? That would spur up a flare. And changing my diet, eating different types of foods, that will start up a flare. Any kind of stressful situation, be it my sons that are ill, I notice that there's change of weather, how I receive that type of weather, because we are people that just likes different types of weather. So I'm a summer girl. So as soon as autumn starts, my body becomes a little bit more stressed, and then I get to winter, and I know that there's going to be some changes in my body. And why? Because of my stress and how I am planning for winter. How am I going to keep myself warm? All of those aspects. I'm not going to walk as much as I used to, and that's going to affect me. So in a way, that pre-stress is already affecting my body, and I wasn't even aware of that.
Yeah, that is so interesting, because I think exactly that of it's really important how we receive things, because there could be something in our environment, but how are we taking it on, and how are we aware of the stories or the thoughts or the planning, maybe the anxiety and stress that comes up around an element like the weather, for example. And it's, yeah, there is some kind of I think a lot of awareness that has to happen, but then also the power comes in the choice of what you do next with that awareness.
Yeah, I think that's so true, because we perceive things so differently. And that your current state of mind either makes you see the light or it makes you see the darkness. There's always a portion of doom or gloom that's going to come out of something, but there's also little reminders that you could give yourself. You know, yes, I can't walk to the bathroom, but I could walk halfway and sit down and then walk again to the bathroom. It is very frustrating, because at times it's like you have no control. I recall at work they would say to me, Candice, you're off sick, but you were well yesterday. And I was like, I know I was well yesterday. You know, you don't have to tell me I was well yesterday. I know I was. I could walk and run and do whatever I need to do. But I woke up like this. It's inexplainable. You know, it can happen at 2 o'clock in the morning. And then I think, what was I actually dreaming of that got me to this stage? And you kind of overthink a whole lot of things. And I found with me is that I've got to keep it as simple as possible. If I know that I've had a bout of sugar and I'm getting inflammation, I know where it's stemming from. I know what my triggers are. And that for me is the things that I found out is, what are the triggers for me, Candice? What is the medication that works for me, Candice? I can read all the reports, and it's very informative with this group, because you also get to learn what has been working for somebody else, and would my body be able to work in that way as well? So there's lots of tips and tricks that I get from the group, that I've tried a couple of times, and if it doesn't work for me, you kind of leave it behind. But if I overthink it and think, why not me, then I'm going to make myself low. And that lowness is just going to make you not want to move, not want to do stuff for you. And could I say that the joy of having to do things for yourself, it's a joy that you can't explain to anybody else. It's like, I want to get up in the rain bath. I want to get into the shower. I don't want my husband to carry me up the stairs. I don't want to see my kids see me this way. So for me, it's how you're going to formulate this. It's yours. And you get yourself a support team and be honest and communicate how you feel about it, and be able to also take their feedback, because their feedback sometimes is really for them to see how they're seeing you from the outside, not from a point of judgment. Because we find when our family are not supporting us as well as we want them to, we have all the thoughts of, you don't love me, you don't care for me, you're choosing something else over me. And it's just, sometimes it's really a matter of, this is what they are seeing, let me rather interpret it differently. And when I'm ready to communicate with them how I'm feeling, then I will.
Yeah, and I think that's a really important thing to bring up, because the people around us, our family members, they're not experiencing the disease as a patient would. And so how do we hold the space of being with our symptoms and being adaptable and flexible around it, but then also communicating that? And I wonder how you see that challenge. What is the best thing that you've experienced or learned from in your own experience that supports maybe buy-in or understanding from the people around you?
I've always been honest with my family as to how I'm feeling. If I'm a bit low, they understand that I'm a bit low today, and they will respect my space. But I have a 16-year-old son that will say to me, a couple of years ago, he said, "Mum, I know you're coming back from work late, and I know you're not going to feel great, but I've run you bath water just so that you can go and soak in the bath and you can feel better." So in a way, they have learned how to see where I am in my space. Or if it's winter, they know that I don't like winter that much. And they will put on the electric blanket, and I'll get a message to say, don't worry, your bed is on. You can go and shower and you can go into that bed. And, it's those little things that just feel like there are people that are standing with you. They understand. Me just being grumpy about how I'm feeling and not communicating is really just going to create an uneasy atmosphere. They couldn't understand how I'm feeling, and I'm not understanding their responses. So if I just, for my kids, I've always just said, this is how I'm feeling today. I don't feel great. Give me 5 minutes just to recuperate, have a hot shower, and then I'll listen to everything that you want me to say. So it's that communication that is so critical. But you've also got to know what's happening within you in order for you to communicate it.
Yeah, what I'm hearing is that you first have to know and be aware of how you're feeling in the moment, and then you have to share that with the people around you, and then give, and this is probably one of the best things to do, is like really specific things that can help. And it seems like the people in your life, your family members, they know the electric blanket will help, a bath will help, these kinds of things. That's in not only your toolbox, but their toolbox to support you.
Yes, no, absolutely. And kind of just sitting with them and kind of explaining to them that these are the things that comfort me. I'm in a space and I'm really low, these are the things that make me feel better. Because likewise, as a mom, it's reciprocated, or as a partner, it's reciprocated. And you not feeling well, do you like to be touched when you're not well? No, you don't. You like space, but I can still offer you care. Even although
Mm-hmm.
you are rejecting touch, it doesn't mean that you are rejecting me. It means
Mm-hmm.
that you are just respecting the fact that I don't like any touch while I'm ill. But leave me a warm drink, leave me soup,
Mm-hmm.
leave me a hot water bean bag,
Mm-hmm.
or a hot water bottle, those kind of things. And I know that there's care there, you know. So
Mm-hmm.
it's knowing your environment, knowing what you need, knowing who your supportive group is, and just being honest with them. We always think somehow that people should know that we are not well. And that's the strangest thing for me, is like, we want them to see. Can't you see I'm limping? Can't you see
Yes.
I'm not okay? Can't you see that my back is paining? I'm like, no, tell me, use your
Yeah.
words. Because when it
Yeah.
comes out of your mouth, you also recognize that, yes, I did say that my back was sore and my foot is swollen. And
Mm-hmm.
you also recognize it. And the other person says, okay, fine, what can we do for your foot? What can we do for your
Yeah.
back? So you break
Yeah.
it down, and it's better for them to receive it.
Yeah, I think that's really helpful because often I think we try to just push through
Yes.
and ignore and just keep going, and that it not only hurts the people around us because they don't understand, but it hurts ourselves because we're not processing what is happening. We're not looking at things realistically and being able to step into the space of, okay, this is how I am right now, this is what I'm experiencing, what can I do to support myself? Yeah, it's really helpful. And I'm also curious, what you mentioned a few triggers, but what are the things that you found that are really supportive in maybe your top 3 things that support you in either managing your axSpA in a way that enables you to work, live, experience life that you'd like to experience? Or also, and then if you have a flare, we'll get to that later, what are the top 3 things that help you? So first, like, what are the preventative things that really work for you?
So definitely movement. I find that the more I move, whether it uplifts my spirit and that makes me feel less down, there's just so many aspects to movement that kind of just prevent me from actually getting flares. And also, if I notice that my body is a bit heavy and uncomfortable, I have a chiropractor that I go to, and I always say to him, Dr. G, all I want to do is sway my hips down the passage. Are you able to help me with that?
Wonderful request.
And that's the kind of relationship that you have with your supportive team, is that they need to know, where do you want to be? You've come to
Yeah.
me for assistance. Where do you
Yeah.
want to be? And how can I help you to get there? And so if I feel a bit better and I feel a bit lighter, I'll just send him a message and say, you know what, Dr. G, my hips don't lie. I'm slowing down the passage. Also, for me to take it a bit lightly, if I describe it as moans and groans, it becomes a moan and groan.
Yeah.
But if I decide to say, what is the outcome that I want from this, and focus on the outcome, then my body accepts it a bit better. It becomes more light.
Yeah, I love that. Looking forward, like what I really want from this situation.
Yes.
It's like a glass half full mindset rather than a glass half empty.
Yeah, it's not being delusional and not understanding what you are currently going through, but
Mm-hmm.
it's that you can spend 2 seconds going through what you currently are experiencing, but then what do
Mm-hmm.
you want from it? Where do you
Mm-hmm.
want? Because you'd rather take yourself out of that and move towards what your goal is, rather than staying too long in the things that are going to make you feel more symptoms.
Yeah.
And then the other is diet, and that I've recently just discovered that it's my diet that helps me feel better, helps, I know the things that will make me feel low. And so I stay away from those things. And I will notice that if I go to a function and I eat a bit more stuff, it affects me differently. So my diet is the major role player in how I preventing flares, should I say.
Yeah, I think that's really supportive, and it's often not spoken about that much because we go to a rheumatologist, and there's, I think, quite a big focus, and rightly so in most cases of the medication, but also knowing that we have other things in our control, like what you said, the movement, the diet, your stress. I think you also mentioned, it's like these are all things within our control that, of course, life can sometimes just get ahead of ourselves, and that'll happen, and that happens to everyone. But there's also these kinds of triggers that just being aware of them can really support you in maintaining the space and the symptoms that you feel like are manageable for you.
Yes, no, definitely. It's really just, like I say, your prescription that you make for yourself. And sometimes it takes a long period of time to find what's going to work for you and what's not going to work for you. But in the end, it's for your own good. It's really, it's what you are reaping for yourself, for your longevity, to prevent the illness from taking over completely over your body.
And I just want to let anyone know who's watching the live. I see you. It's really great that you're with us here. If you have any questions, pop them in the chat. We're already getting some comments from Seleng saying she loves the discussion, and you're really breaking it down into like into simple ways that you can grab hold of, and it's a very useful reminder for her to hear about these things. And at one stage, I don't know which stage, but she wholeheartedly agreed with you and gave us an amen. So it's wonderful too. Thank you, Tseleng, for that. And I wonder also if you, from your medical, and I know this is we're not giving any medical advice here, this is sharing your journey, but your experience as a nurse, what insight or wisdom have you gained from the medical side of things that have informed how you're living with this condition?
I've realized there will always be a drug to prescribe for every kind of thing. And sometimes when you overpower your body with too much drugs, your body also just wants to eliminate and deal with that. And with us in the medical field, you know that, oh, I'm feeling this, let me rather get a prescription, and we sort that out because we must do it quickly because you need to get back to work.
Yeah, we want a quick fix.
Exactly, we want the quick fix. So we want to try everything. And I've learned that to communicate in my field as well. It's a matter of, I give the doctors that I usually work with something to think about. Like, what if we don't medicate? What if we kind of just leave it for the 3 days and see how it goes? With my enthesitis, it always lasted for 3 days, always. Start off real small. In the end, I'd see a little red bruise there, and then I can't move. And then after 3 days, I could jump on a trampoline, and that's just how it is. And with us in the medical field, it's hard not to look for a quick solution. It's hard because you want to be at work, you want to be present, but I can't move ankles. So you also have to realize that rest is so critical, but it's also how much your body can take rest. Because for me, if I rest too long, I've made the situation worse, and I've ignited something else, and something else. So you know that your rest is for just that, but it's not for moping, and it's not
Yeah.
for just feeling low. Because for my body, if I say, oh, I've got lower backache and I'm just not feeling well and I want to sleep for the day, I feel so much worse at the end of that day.
Mm-hmm.
Whether
Mm-hmm.
you get yourself out and you lay in an Epsom salt bath and you massage your body with some oils, just that little bit of movement kind of gets you going. It really
Yeah.
makes you feel better. It does a whole lot for you. So I've
Yeah,
learned,
exactly.
to limit the medication, in the sense that, what else can I do? What's supporting me? Even although I'm aware what an anti-inflammatory can do for me, it can make me get up and it can make me move straight away. But what else is it doing to me? Can I find something else that could have the same property of an anti-inflammatory? And I've taken anti-inflammatories daily for, I think, 2 years at one stage. And I'm at a space now where maybe I will take an anti-inflammatory once every 3 weeks. So for me, I'm working on the plan that is best prescribed for my body. Having a physiotherapist that is at hand should I need it, having the chiropractor, the rheumatology visits, and saying to the rheumatologist, at one stage I went to the rheumatologist and I was like, I'm taking too much meds. It's just, I don't know what each of them is doing. And I said to him, I'm gonna stop everything. And he said, Candice, are you sure? I said, yes, I want to go to baseline medication. I want to start right at the bottom. I lasted a week, but I gave it a go. So
Yeah.
after a
And
week,
I
I
did,
was like, doc, not working. You're like, we can't do this anymore.
but
But
I
for
think that's,
myself,
yeah,
I tried it. And I was like, now
yes,
I know it doesn't work.
yes.
But he gave me the
And
opportunity, and I loved that.
yeah, I think that that's the important part, right? That this is your journey. You're the leader. You have a group of people in your team supporting you, including the different medical professionals around you. I think AXPAR is one of those conditions where it really is helpful to have a team of people that surround and support you. But this knowledge that it's all your choice. You have the choice to go this direction. You have a choice for asking about what are the alternatives. You have the choice to seek other care, but it's you're deciding. And I think that's a very powerful place to be in, and that you take on that ownership. And yeah, thank you for demonstrating that. And if it took you just throwing all your meds down the toilet and realizing that you actually need to come back to all of them, or at least some of them, but at least you felt like you needed to know what your meds were doing. And okay, this one's for this one's for that. And that in itself is like, yeah, it's an empowering process to go through.
Yeah, I was explaining to a colleague of mine, it's like an interactive movie where I get to press the buttons as to what's the next step and what's the next step. And some roads, unfortunately, you don't want to go back there. So you take your remote control and you choose a different direction. But it's guided by you, because when you make the decision, you kind of take on the task better. That's what I find with me, is that if I sit down and it's an informed decision and I say, this is how I'm going to go forward, I get to respond to the medication better. We can all take Bernardo, and based on how we're feeling, can work or it doesn't work. But if you like, I am going to be headache free in the next 30 minutes, chances are 9 out of 10 times you are going to be headache free in the next 30 minutes. It's kind of your mental ability to support your treatment, to support what you wanted to do. And I've taken on a lot of mindful lessons as to reading positive quotes and directing things to where it should be. If I take an anti-inflammatory, I'm mindful of the fact that it needs to get to my knee and it needs to make my knee better, because I want to go for a walk later on today. And it's that we are so busy that we just like, we're here and we're popping pills and we're like, it's going to make me better, and I'm going to be healthy. But you yourself, you need to accept the fact that this is the purpose of this medication. It has a destination, and it has the ability to get me to move to where my goal is actually set.
Yeah, just seeing the bigger picture, I think, like you're saying, is so important. And also something that you mentioned earlier, Candice, that I want to shed a spotlight on is finding the balance for you as a person. And you mentioned it in terms of movement, that both movement can be really supportive of you. It really helps you to stay in that preventative flare space, which we all want to be in. But we also know that there is a time and an important time for rest. So
Yes.
How do we find this delicate balance? And I think what I'm hearing from you, and you also add your thoughts here, is that you get to know who you are, but then also you get to contextualize your scenario. So whatever is happening in your environment, we don't want exercise to ever be a stressor for you, but you're figuring that out, and you're getting to a point where you know this is a good space for me to be in terms of movement, or I'm overdoing it. Am I getting that right?
Absolutely. I recall trying a personal trainer one day, and I was explaining to the personal trainer that let's not go too hard on the exercise because my body responds with the flare. And he said to me, no, I don't think that's going to happen. So I did the exercise the way he wanted me to, and the next day I was like, well, I move my shoulders, so I think it's going to be rather difficult for me to scrub at work today. But then I know how far to take myself. And sometimes people don't receive that. They see you as being lazy. They see you as not wanting to get to your goal. Goalposts change all the time. And I have accepted the fact that I am not going to feel guilty for a goalpost changing. But I want to be comfortable as to where I currently am. There are people that are very sporty and they kind of push themselves and they want to do more, and they see themselves doing the Muddy Princess. And I aspire to do the Muddy Princess, but I want to still walk out of the Muddy Princess. I don't want
not crawl. Yeah.
So also just and then once you know your body, you go to physio, you go to a chiropractor, and you say, don't hyperextend me because it gives me a flare. Yeah. And they also appreciate that information because they know that maybe they need a different kind of tact for you. And it gives them the idea that, you know what, maybe this is the patient that needs a different hand, let me treat them in a different way. And never mind, I have 15 axial spa patients, but she's different and she identifies that she's different and her needs are different. And also, what work are you doing? Are you sitting at the computer? My neck is an aspect that I want to be better, or my lower back, or my feet, or I saw somebody had a post about burning feet. And that is the most horrible thing you can experience. And especially for me, as a nurse, standing on your feet all day. I've got 5 pairs of shoes that I have at work that I interchange because sometimes you think it's the shoe, you think it's the inner sole, you want to go to the podiatrist, you want to do so many things, and sometimes it's really, what if it just needs a massage? What if it just needs relaxation? And that works better for you. So for me, it's a matter of knowing how much is too much, how much is harmful, how much is not moving.
Yeah, exactly. And I definitely hear a theme of like awareness of self, also flexibility and experimentation. So let me try this for a bit, let me try that. And making sure that you know where you're wanting to go, and these are the different tools that you can use to support you. And then also having the courage to speak out your boundaries to medical professionals, to friends and family. You know, this is, I know that this is what works for me. How do we put that into practice while we're doing an exercise session, or yeah, any other kind of medical support that you're getting?
Yeah, and it's very frustrating. You don't just, for the new members that are there, you don't just get to this space just like that. It is
Yeah.
such a long walk. It's crying in the shower. It's being frustrated while you're at the physiotherapist because it's really painful, but you know you need it. Is locating
Mm-hmm.
those hot water or hot beanbag packs wherever you need them. It's getting that back support, shoulder support, knowing it's not going to work, try something different. But
Mm-hmm.
you will find your fix. You will
Yeah.
find what works for you. You just need to realize that it might not be today and it might not be tomorrow, but that's where you want it to be. That's the desire.
Yeah, exactly. And I think you're the perfect example of figuring out where it is that you're wanting to go. And you can tell us, you've told the group what your top 3 things are that help to maintain you. And just having that knowledge, it comes from the experience of living this with this disease and figuring out what are the things that have helped other people, how might they help me, who am I as an individual, and how do I combine all of this to go forward?
Yeah, I think it's knowing self.
Yeah.
From your thoughts to your actions to what you feed yourself, visual and physically, and how you exercise this body that you want to keep moving forever. You know.
Mhm. And tell me, is there any other advice? We have a few minutes left. Any other pieces of advice or tips that you'd like to give to the community?
I think it's really just finding your prescription for you, um, voicing what your needs are, understanding firstly what you want. Sometimes we want 10 things at a time, and maybe it takes time out to work out what is the first priority, what is the second priority. Um, and knowing that no doctor has got a magical prescription for you. You
Mm-hmm.
are going to get very frustrated with different doctors, different medical professionals. You're going to get irritated by the fact that you are not healed ASAP like you'd like to.
Mm-hmm.
Keep a jotter out for yourself. Keep a diary out for yourself. How you're eating, when you feel effects. It makes you get to know your body better, especially when you read it and you say, oh my gosh, it was my birthday on the 20th of May and we had so much cake. On the 22nd of May, I had a flare. Could it be from that? It kind of just gives you a visual representation of how your body is working and responding. you know when did I start the new treatment? When am I feeling the side effects of this medication? Is the
Mm-hmm.
itch caused from the grass I was standing on, but in my head it feels like it might be the silazapyrin that's actually causing the itch?
Mm-hmm.
So
Mm-hmm.
just be aware of the things that are happening around you. What are your triggers? What are the things that get you feeling low? And how long after you are low do you feel a symptom?
Mm-hmm.
It's those things. For me personally, my mom passed away when I was really young, and I think that is what triggered the change in my body. I was nursing and I was a student, and she passed away in the same hospital. And if I think back, that was my trigger. That was where I just had to move on, and so my body stored the stress in cells, in wherever, in my
Mm-hmm.
back, and I did not know in the medical field. You just get advice from every doctor, and you kind of do it You don't sit with yourself and say, okay, what are the things that was a major stress in my life? Was it an accident that I was in, and now I'm sitting in a position where I have this autoimmune disease and I don't know where it comes from? I don't know any family members that have the same disease as me. Am I the first one? Why me? You go through all of those things, but identifying that it's mainly for me when stress is actually starting and I can feel the effects on my body. My body is telling me, hey, think about where you currently are and work on how you want your body to feel, because your mind is in control of so many aspects of how you actually function. And with the inflammatory bowel disease, it's also the same thing. You stress about it, your gut's going to tell you you are stressing. You're going to do an exam, your gut, your whole GIT tells you that you're going to do an exam because you have stomach cramps, you have nausea, you don't want to eat, or you have diarrhea. It's that what is actually working on up there is a direct illustration as to how your body is actually processing everything.
Yeah, it's like that saying, where the brain goes, the body follows in many cases.
Yes.
Yeah, thank you so much for sharing that experience with us and highlighting the importance of processing and kind of doing a reflect and a review of where am I right now? What is happening in my life? And being, I think, understanding enough and empathetic enough to allow space for that if you have time, and to process that, because that in itself can manifest into the joint challenges that we have, the flares that come with axSpA. So I'm really glad that you highlighted that, and it's important piece of this all is to pause and reflect.
Yeah, and I think I find having a little journal is so critical, as with any illness, whether you have bladder dysfunction, and you kind of keep an information in a book that you can say to the doctor, this is what I experienced for the past month. I went to the bathroom 25 times in a day, and they get to see a little pattern. We go to the doctor and we are sitting there, and sometimes we're overwhelmed that it's a medical professional and we know that it's a limited time. And so we don't know all the information that we knew it in the seat outside, but when we get inside the room, it's like, what was all the things that I needed to actually say? And they start asking questions guided by what they want, but then we forget about all the things that we wanted out of the appointment. Writing it down makes it so much easier, because they really have to listen to you. You're there for a consult.
I mean, and it's valuable information.
It's a two-way conversation, and they would get to at times treat you better by the information you are feeding out. That my gut is affected, and they might say, okay, fine, this medication, I think it might affect your gut, let's try something else. But you get to the appointment and you forget all the things that you wanted to say, and then you're stressed now because they've made your treatment stronger. Do you need it to be stronger? How's it going to affect your body? And you leave with so many questions, and the next appointment that's available is in 6 months' time. And you sit with that and you are so frustrated with yourself. You're like, but why didn't I do this, that, and the other? Just jot this stuff down. When you get inflammation, when you see a physiotherapist, write it in your diary. And if you go there and you say to them, I've had 20 flares since my last visit with you, and it might be 2 days after I take methotrexate. So maybe we've got to think, is it doing anything for my body, or is it not doing anything for me? How do we go forward? What are all my options? What are my plans for me, medication-wise? What can you offer me that might be better for me?
Yeah, it just makes me think of we go into our doctor sessions and they have so many questions for us, and I almost want us to match their one question with two of our questions. You know, we get to speak more, we get to ask more, and yeah, just flip it a bit so that it's
the fact that they are on the receiving end. We are the map that they need to discover. You know, it's that I'm here, and even if we go to the GP, we say we have the flu. Why do we tell them we have the flu just for the prescription? No, my head is sore. I have a fever. I've been feeling nauseous, and I have diarrhea. You know, they also they need to deduct. You know what? Is this gastro? Is this what is this? There are so many. So when we go and diagnose ourselves and be like, okay, so we have the flu, and he's like, oh, okay, so you have flu symptoms. Yes, I do. And then you get a prescription, and then you leave. You're like, oh wow, I was treated. It's their job to actually identify what we have through what we explain to them. That's the idea.
Exactly. Candice, I think we could chat for another 2 hours. And a huge thank you for sharing your experience, your story, your journey, as well as your expertise in the medical world. And really, I think you've given some tools to our audience that they can take on board, either to experiment with their own health, but also to empower them in those sessions with their doctors or medical professionals. Because this is, like you said, this is our own journey, and it's important for us to give ourselves our own prescription in all the different facets that is the wonderfully complex and diverse space of AXPAR. And yeah, so thank you for sharing both the nuances and complexities of the condition, but also simple ways and strategies to manage it.
No, it's an absolute pleasure. It really is.
Yeah. Thank you. I'll stop the recording there, and yeah, we'll see everyone on the Facebook group. If there are any questions, just pop them into the live comments, and we'll get to them.
Thank you very much for having me.
You're welcome. There we go. Stopped that. Let me